happen. So we ever need to take it to the next step, we have an inside resource to help just make sure that you guys have the best experience possible. So I want to start us off by just saying what the intent of today's meeting is. We are going to go over the changes for 2022. This is not a full plan review. This is just highlighting what is changing. But of course, I brought Sean with me to talk about the member ads that are included, the things that make Blue Cross so special, and then of course, if you have any questions, we'll address those as well. The idea is to understand how your plan is changing for next year so you can decide, okay, now that I know what the changes are and you have an idea of your health history and maybe what's coming up, you can decide from there, okay, does this meet my needs or do I need an appointment to talk about things? So we are going to still offer in-person meetings, over the phone, Zoom, to address those who have had changes to their prescriptions, their health, their doctors. Those are still things that we want you to double check with us, even if you're happy with the plan, so we can at least prepare you with how that will affect you, what you need to know, how your plan is going to cover those changes, okay? So we're going to get started. We're, again, going to be talking about the True Blue RX St. Luke's Health Partners HMO plan. So it is specific to the St. Luke's network. There is other providers in the St. Luke's plan, so we just have to double check that provider directory, but it is predominantly St. Luke's. They do have some other facilities in there like Primary Health and Salter, I believe I saw is on there. Those are a lot of clinics we're seeing pop around throughout the Treasure Valley. So don't knock it just right off the bat. If you see St. Luke's, there could be some other providers in there. It just excludes the St. Al's physicians specifically, not in an emergency situation, which I will talk about later. Medicare will always give you that protection in an emergency situation that you do have coverage no matter where you go. So my little insurance joke is no one cares where you go, just don't go toward the light in an emergency situation. Insurance will cover it. So without further ado, let's get into some of the changes here. There's been some minor tweaks. I always like to start off with just recapping from the top. Well, we're going to start with premium. Blue Cross is keeping it a zero premium. It's the same in 2021 as it will be in 2022. That's a big deal because I work in the individual market, the under 65 market, and I'm seeing premium increases every year. So I always say that's a benefit to Medicare. You're on the Cool Kids Club. Basically, you guys get some greater advantages, and one of them being a stable premium is a big deal. So we like that you don't have any additional costs. You still have your Part B premium you pay. That's going to come out of your Social Security check if you're drawing Social Security. If you're not drawing Social Security, that would be a quarterly bill, or if you set it up to come out of a checking or savings account monthly. So right now, that's about $148.50 a month. And if you think that your bill is a little bit different, you should give us a call because you might have something called IRMA that's attached with that. That's an income-related monthly adjustment for higher income earners. And again, we can help with those people who may have that offline. So just let us know. The next big thing, oh, we're going to keep it on the screen. Next big thing, maximum out of pocket. That's an important term, I feel. This is basically your stop loss. If you have a rough medical year, all your copays will accumulate towards this maximum out of pocket. This is for your medical services. So if, God forbid, knock on wood, you were to hit this number, then you have 100% coverage for the rest of the year. However, I'm going to do a little pop quiz. Percentage-wise, what percentage would you say the people meet this maximum out of pocket, if you had to guess? 80%, you think the max out of pocket? Oh, it's a good guess, but it's actually going to surprise you. It's a lot lower than that. Do you happen to know from Blue Cross claims data what you guys are seeing on average?
Ready? Do we have any more?
Any more guesses? Do you want to take another stab?
Well, say 50 then.
50, okay.
1.8%.
Oh, really? So, but, I mean, medical costs are so expensive. Are they just really, everyone's being really healthy?
No, the copay, it's not so much that. I mean, that's probably a factor, of course, but the copays are designed to be so low that it takes you a hot minute to get there. So we're going to talk about what happens when you're in the hospital and surgeries, because those are the big expenses people would assume would absolutely hit the maximum out of pocket. So I have a lot of people, and Sean, maybe you could attest to this too from your experience, that solely pick a plan based off the maximum out of pocket. However, with a 1.8% of people actually needing that, we can eliminate that fear because we are addressing those high cost services with really low copays. Sound about right?
Absolutely.
Okay, and again, 1.8%, that's a pretty low number. It's not impossible to reach that, but you'd have to have a pretty rough medical year, and most of the time you have maybe an off year or two, but in general, it's not like that every single year, right? Yes,
So there's no deductible.
there is no deductible.
Yeah, that-
You're gonna go straight into co-pays.
We're still in corporate America insurance and we have deductibles and that's why that maximum, we've met that just because I've had to pay, you know.
Absolutely, absolutely. So
So that plays in.
the nice thing about Med Advantage plans that I would say is they're designed to be transparent for you to anticipate costs, which is why I always say, if you know you've had changes to your doctors, prescriptions, your health, let us know because we have basically reads like a food menu, the summary of benefits. Oh, x-rays, $15. Oh, surgery is $250. I can anticipate that cost now and show you what those numbers are going to look like before you even have the services done. So that gives a lot of peace of mind. Okay, we're gonna go into everyday services. So we love that Blue Cross is keeping the primary care visit at a zero copay. So I am highly encouraging people to go to their primary care doctor for most things. A lot of times people will just want to go straight to a specialist, but there's a way to save money. You don't have a higher copay. Like on the specialist visit, you're going to see that there's a $35 copay next year. But no cost to see your primary care doctor, and you'd be surprised at how much they can actually do for you without having to involve a specialist. So between time also and money, that's a big saver because right now I am seeing an average of 6 to 8 weeks to get into a specialist, certain specialists, so sometimes more. And this is usually a good frontline defense that you can go in and get the ball rolling. And from there, your primary care doctor can refer you. Okay, any questions on that so far? Anything you need to add on that? Getting pretty good? Okay, now we're going to talk about the big scary stuff. What happens if you're admitted to the hospital? People immediately assume I'm going to hit my max out of pocket if I were at a hospital for an extended stay, especially with COVID going on right now. However, it's not necessarily the case. So let me tell you what the benefit was this year and what it'll be next year, and I'll dive into it. So this year, the inpatient hospital stay is a $295 copay per day for the first 5 days you're in the hospital. So I tell people this kind of works like an all-inclusive resort you never want to stay at. So it's going to cover your room, your food, your surgery, your lab work, your imaging, your doctor consultations, you name it, it's covered in that daily copay. And you have to be inpatient for that. There's definitely a difference between inpatient and outpatient. It does adjust slightly in 2022 to $315 copay per day. Again, that's days 1 through 5. If you are there longer than the 5 days, the plan will pick up 100%. So it doesn't matter if you're there 5 weeks, 5 months. If it's part of the same stay, you're just paying that copay. So if you take $315 times 5, that's not going to hit even half of your max out of pocket, which is where, again, people usually would make that assumption, oh my gosh, it's going to be the biggest expense. It's actually not. So we really like that it keeps that cost down. So it is a minor tweak from last year, but I want to say something. Even though I have these highlighted in red, which we kind of associate with a negative color, they may have some adjustments, but we have a lot of positives. So the carriers tend to look at utilization and they're going to try to put money back into the plan, but based on utilization, they may take a little bit over here to add over here. Does that sound fair? Is that about how you guys? Yeah, so you can't just go, oh, okay, we're gonna make everything a positive change. You might have to grab a little bit from this area. So they're not looking usually at the most utilized services. So if you're seeing a slight adjustment, it's usually because that one is not one that's being used every single time, or that change is actually more in line with the other plans in the market. And the other thing I have to say, I'm going to bring Sean's knowledge in on claims data. What's the average hospital stay? If you had to, no?
I would say 3 days.
Yeah, that's exactly, I see it's about 2 to 3 days.
That's my
Yeah,
guess.
so not even 5 days you have to worry about. I think that's pretty good. You got it right. Yay! So most people, again, are like, oh, 5 days, but most people are discharged within 2 to 3 days. So that's typically what we see. Pretty good deal. All right, we're gonna move right along. Again, I got some green on the screen to show us the positive changes. We did see a slight adjustment on the hearing services. So for Medicare covered diagnostic hearing exams, this year was a $30 copay. Next year it will be a $35 copay. There are two buckets with hearing. You have a medical bucket and you have like a hearing correction bucket. So this particular part is talking about the medical bucket. So let's say you have like infection in your ear or something like that. I was trying to think of other examples. Maybe you had something in your ear. I don't know. People sometimes get something stuck in their ear. I don't know. I think maybe of children, but I've seen it happen. I think I saw a video where a gal had a small crab come out of her ear. Don't want you to have that, but again, it's a minimal copay, $35. It's a small adjustment for next year. The biggest add-on that we're seeing that I'm going to highlight is going to be, we see reductions. If you buy hearing aids through True Hearing, there's two models. So their advanced model is $699 per hearing aid, or their premium model is $999 per hearing aid. Last year, or this year, excuse me, there was an extra charge of $75 if you wanted that to be rechargeable. Next year, it's dropping to $50, which we love to see that. So you have the option, instead of doing battery operated, you can have that be rechargeable. And then also all these extra add-ons. So we see that they took away the 3-visit limit for follow-ups, because you may need to have adjustments. It's a brand new thing. We had one client, bless his heart, had brand new hearing aids and the adjustment or the settings weren't quite right, and when a car would drive by his house, he thought it was coming through his home, so he was hiding under the kitchen table. So you want to be able to have that option to go get those adjustments until it's the right fit for you. So now we're not limiting for the 3 visits. Also, look at this, you have from a 45-day trial period to a 60-day trial period. That's a pretty nice add-on. Still keeping that 3-year extended warranty, and then instead of giving you 48 batteries per hearing aid for the year for non-rechargeable model, you're going to get 80. That's a pretty big deal, because those batteries are super expensive. And I've had people tell me, well, what about Costco? Well, you know, this I see is actually a lot of times a better value than some of the local vendors around here, but I'm not an audiologist, so I still would encourage you to price check and see those differences in the features. Technology has come such a long ways. We see Bluetooth capability. Literally saw a gal go in the grocery store, she's holding onto her shopping cart, answer. I'm like, where's her ear? She's talking in her hearing aid. Hang up. Her hands never came off that shopping cart. I was so jealous of that. I don't even have that with my AirPods. And then also the I know, right? We always want the next best thing. And then they even have an app usually where you can adjust the settings to work with the environment that you're in. So if you're in a concert versus a quiet library or a meeting, then it will recalibrate those settings for you. And you can have a number of presets. So again, technology is cool. What a great time to be alive. Definitely check out this benefit, because hearing aids are extremely expensive. I had a client get a quote from Miracle Ear. A pair of hearing aids was $8,000. This is $2,000 at most if you take the premium model. Did you have a question?
Yeah, I was just saying, that's the cost of the unit. It's not a benefit towards the unit. It's
right.
What they cost.
Exactly. Yeah. And that is per hearing aid. This does not count towards your maximum out of pocket. So this is an added benefit at no charge to you. It's not required by Medicare, so we're glad. And not every carrier has hearing aids built into their coverage, so it's actually a really big value. Okay. Is it going? Oh, it doesn't want to go. Dang it. We were trying to get fancy. Yeah, it was a good try. Okay, let's talk about prescription drug coverage. We did see some really positive changes here as well. The deductible remains $125. It is only applicable to your brand name and specialty medications. So if you're taking routine maintenance drugs, tier 1, tier 2, and I'll talk about the maintenance drugs in a second. We might actually talk about some of that too. Basically, you don't have that deductible. You're going to go straight into the appropriate copays. And if you're not sure what the tier level of your meds are, you can send us a list and we can get that breakdown for you. But these prices are for the preferred pharmacy. And if you're not sure if your pharmacy is in that preferred pharmacy network, again, we can let you know. Just tell us what your pharmacy is, or if you want, we can just send you a list of all the preferred pharmacies if you're happy to make that change. But you will get the most savings if you use a preferred pharmacy. So tier 1 preferred generics, 0 cost. And if you're taking a standard generic, it's going to be a $6 copay. Usually you can get a better deal through mail order, so we do encourage you look into the mail order options, especially if you can get, you know, a 100-day supply versus a 90-day supply at a lower cost. Then you have your brand name drugs at $37 or $90 copay, depending on that tier level. And specialty drugs are our most expensive medications, so it's a percentage. It's hard to guesstimate what that cost is. So again, let us know what those meds are. We can try and get numbers for you. That changed slightly this year from 29%. It'll be 31% next year. I have some really cool tricks in my bag about specialty medications. I will look up meds with hospitals. They're a patient assistance program. They have usually a prescription patient assistance program. Nonprofit organizations as well, I will also look into to see if they will work with Medicare, including manufacturer coupons. Not all of them work with Medicare, but I do know of a few. And then sometimes I get really creative, and we have a local company here called Universal Prescriptions that will work with pharmacies outside of the United States. So we have a pharmacy in Canada, UK, New Zealand, and there's also a manufacturer in Florida that they have contracting for. So as much as we love insurance, sometimes we have to add something else in addition to the insurance coverage that we have to get you that optimal cost, right? The one that is not going to affect your wallet as much. And prescription drugs happen to be the most costly thing that I see Medicare beneficiaries face because they don't apply toward their maximum out of pocket. In fact, you face something called the donut hole, dun, dun, dun. And we'll talk about that again in another presentation, or if you have concerns. That's usually for people who are taking a lot of medications or very expensive medications. What I'm really excited that Blue Cross decided to do for 2022 is add a tier 6 category, the maintenance drugs. Do you want to talk about that?
Yeah, so we had lots of customers requesting to have a larger quantity of drugs. So we've added a new tier 6, so you can get up to 100
Maintenance drugs.
100 maintenance drugs.
I
yeah.
love that. So
Yeah, the
just
list isn't
standard.
real long yet.
Yeah.
You know, they're still building it, but you know, each year we'll just continue to grow that tier 6.
That's
And
awesome.
that's through a mail order system or something?
No,
So the tier 6 drugs are it's just a prescription that you get filled for a quantity of 100.
at zero.
Yeah.
Zero copay.
So it's a special kind of drug, or?
There's a list of drugs that,
Oh,
that
that
are on
qualify?
this. Yeah, and they're
Oh.
usually like the routine
Yeah.
maintenance. Probably, and I have to double check, so don't quote me, but it's probably gonna definitely include like your cholesterol, blood
Oh, I see.
pressure, the ones that have been around forever that, you know, honestly, from a carrier standpoint, it's sometimes cheaper to just cover those drugs to make sure that you get them to keep you out of the
Right,
hospital,
yeah.
right? So I think that is a huge value add, that some of these drugs may have been in this tier 2 category, like a standard generic,
Oh, I
where you're
see.
paying $6 each month.
Oh.
And now it's gonna move to a tier 6. So we'll have to look at your list to be able to see if that fits in
I
that.
was thrown a little bit when you said something about 100.
Oh, 100-day supply,
Okay.
which is huge.
Yeah.
I mean, first
Yeah.
of all,
Carriers offer a
190
90-day
days.
supply.
yeah.
We're offering 100.
So you don't have
Yeah,
to refill
okay.
as much. That's a big deal, especially with gas prices being as high as they are now. If you don't have to go to the pharmacy as often, I always think that's a win.
But once again, just for clarity, it has to be one of the preferred pharmacies
Yeah, is that how the
On
tier
the-
6 works?
On the maintenance,
to get your tier 6 drug. Is that a Blue Cross?
You know, that's a good question. I can look into that for you.
I'm
And find
just
out.
curious.
yeah, and I don't know that one yet either, so we'll have to
Okay.
take that
Okay,
offline.
thanks.
That's okay, though. That's a good question.
Yeah.
We'll find out.
Yeah.
But usually, and I'll also find out too, if it remains zero throughout the donut hole, because that's usually another characteristic that I'll see with that, which is nice. So I would say those are the 2 questions there.
And which mail order service does Blue Cross use?
CVS.
CVS.
Perfect. Okay, so another positive change for 2022. So this copay is your emergency care wherever you go. So this is actually set by Medicare. It's pretty much the same. It is the same on all plans. So it's a $90 copay when you go to the emergency room, whether you're in Idaho, California, New York, Texas, it doesn't matter. It's $90. But I thought this was really unique. I've never seen a carrier break down this before. I didn't even know this until I read that ANOC. So it says additional cost sharing applies for advanced imaging services when you go to the emergency room. So that's during an emergency room visit. That was something that was not included in the copay, and next year it is going to be included in the copay. So instead of having a $90 copay plus the imaging copay, you're now going to see in 2022 that that's included in just that $90. So that's putting money back into your wallet. So I think that's pretty big because I see most people go to the emergency room not formally admitted. And so when I saw the tweak on the inpatient hospital copay go up slightly, I actually thought that this was a great move for you guys to do that because more people go to the emergency room and are sent home than they are actually formally admitted. So this was a big value add.
What about basic imaging? There's still a cost sharing for that, I would assume.
Like a standard
X-rays.
X-ray. The ANOC didn't specify that, but I can double check. I would assume so if they're willing to pay for the big
The
MRI.
advanced, yeah.
You might as well throw the little cheapy X-ray in there, right? I would assume, but we can double check just to be sure because that verbiage was not specified in the ANOC or the annual notice of change. Okay, so another few little tweaks here that we saw, outpatient hospital observation. This year was a $200 copay. So this is when typically some people get confused, I would say, between are they admitted or are they under observation. You can be assigned a room and be under observation status. Technically, the hospitals are supposed to give you a notice that say you are not formally admitted. This is just observation. It doesn't always happen. So I strongly encourage that you ask that question yourself. Am I being admitted or is this observation? Because they are very different in the billing, and you will definitely see that. Remember, in the very beginning, I said inpatient is that all-inclusive copay that covers everything that happens to you while you're there. When you are outpatient, it is itemized. So just make sure you're double checking. But it does go up slightly from a $200 copay to $275 copay. So it's a slight modification there. And that's pretty in line with most of the carriers that I see too. Outpatient mental health did go up slightly as well. It went from $30 copay per visit to $35 copay per visit. That's whether it's an individual session, a group session, or a partial hospitalization. So remember, this is specific to mental health. So if you wanted to see a counselor, this would be a $35 copay starting in 2022. That's pretty standard with what I'm seeing also in the market.
Is it the same for virtual or is that in office exclusive?
Oh, that is a good question. This was for the in-office specific.
Okay.
Does Blue Cross offer a virtual for that?
So there's the telehealth services,
Mm-hmm.
which maybe, but I don't know if
Oh,
it's.
It looks like
I-
those were included at $0 to me. I was
Yes.
just curious.
I actually have that on another screen. Hang on one second. Let me see if it's not that one. It's right here. I'm gonna skip ahead for a second. Here's your telehealth.
Okay, so it does.
So
have mental health.
it does, so it's $0 for primary care, mental health, or substance abuse. The only charge that you're gonna pay is when you see a specialist or a psychiatrist. So usually the psychiatrists are the ones that prescribe the medication, different than a counselor, okay? Or a licensed certified social workers. Usually the LCSW is what I see with most counselors as well. So that's a nice plug-in there to use telehealth when you can to save on costs. So instead of paying $35, you can just pay the $0 copay. And why sit on a stranger's couch when you can stay in the comfort of your own home and, chat with somebody that way? That's a good option.
Although my therapist does do Zooming these days, but that's all the COVID stories. That
Yeah.
she bills out as a regular office call.
So if she
Different
is
than telephone.
if she is in network on this plan and she does offer Zoom services, then it should be
That would
$0.
qualify as a telehealth?
Yes, because it's under mental health, as long as she's not a psychiatrist.
Yeah, no, she's an LSW, but, no worries. Either way, okay, wow.
It's a $0
Yeah,
versus
So-
35. And this
Yeah.
is why we like pointing this stuff out, because sometimes if you knew that there was an alternative, you would have taken the alternative because it saves you some money. Especially if you're
Yeah.
going to weekly counseling visits, that can add up really
Yeah.
quickly. So why chew at your max out of pocket and click that down when you don't need to? So they're trying to make this more convenient, readily accessible, and just more affordable in general.
So she would build it out differently then, because I mean, she gives you an option to either come in the office now. I mean, it's been a crazy year because everyone was totally out. Now
Right.
she's weaning back in. But she's still allowing Zooming, kind of like you guys, this story
Yeah.
today. But she bills it the same way. But you think that she could bill it differently, potentially?
I think they're gonna continue to bill that as an office visit. I
Yeah.
think it's-
It's all gonna
It's not
be-
mandatory. I mean, it's a choice. I mean,
I know that goes into the contracting details between providers, and we don't get all of those details
Okay,
privy to us. This is what I can tell you with confidence, though. It all comes down to the coding and the billing.
yeah,
So
that's
if
what I
they're
figured.
billing it
Yeah,
as an office visit
Yeah.
versus a telehealth,
yeah,
it begs the question to your counselor, though, wait a minute, I have coverage for telehealth, maybe she gets paid differently,
Yeah.
and that's her reasoning,
Unless
I
Yeah.
don't know.
yeah,
But you do have that benefit available where it's
Yeah.
supposed to be more cost effective. And, again, it's one of those things I'd say, maybe I'd come more if it was more affordable, but
Yeah.
that'd be playing devil's advocate,
But-
sorry, I'm not trying to get anybody in trouble, but that would be
Yeah.
my saying, you know what, if this truly is a Zoom meeting, why am I getting charged for an office
Yeah.
visit? I'd probably use you more if I was able to keep it at a more affordable rate, and
Yeah.
you'd get paid more in turn. I just play devil's advocate.
because then when she would need to be part of the providing,
Correct, the
provider.
network.
or network, excuse me, and then secondly, so she's made a contract with Blue Cross, as it were, I mean, allegedly.
Yeah.
And then therefore, the decision, I mean, right, billing. But to
Right,
date, under the Corporate America program we're in, she bills it as a regular office call.
Yeah.
And, no worries, I'm okay, but even if, the $35 is still pretty affordable.
very
I mean,
affordable,
so I would
absolutely.
honor.
Yeah, and there's
Do you
certain,
think she gets paid more if she bills it as an office call versus telehealth, or you don't get into that?
Right now, they're billing them just like an office visit, so I think it's probably just the same.
Yeah. Okay. No worries, I mean, yeah, but. okay,
it's hard to
that's just-
find a good person, so if you wanna keep with your person, cause
Yeah,
it's
yeah.
again, you have a relationship and that
Right.
rapport build up, and it does suck to start over
Right,
with
yeah.
counseling. Like, I already went through my childhood traumas, I'm not starting that again.
Yeah, yeah.
I get it, we want you to keep your doctor, so we'll just have to look to see, because I do have, sometimes people will say, wait a minute, on my explanation of benefits, it says it was an office visit, but it was really telehealth. Why am I getting this charge? And then we usually contact the provider and say, hey, this is what the client's saying. I think there's a coding thing. Will you reprocess the claim? And then sometimes it's a fight. Sometimes it's just a simple conversation and calling the attention out to the provider, like, we on to
Yeah.
you.
Yeah, well, and I think it's such a
That
new,
happens regularly.
it's such a new concept.
It is,
You know,
but you don't know what you don't know, and you never know if you won't ask, for
Right.
sure. So we want you to, like I always say, there's no question too big or too small. And if they're trying to bill for a physical appointment versus a Zoom meeting and it's costing you more money, we want to address that. There is
Okay.
no reason. And that's not even a fight you have to fight. You
Yeah.
put that on our
Yeah,
plate.
that's good,
Might as well. The worst they can say is no, right?
Yeah.
And there is a formal process even at a carrier level, because I've run into situations where a hospital has been reluctant to change billing, even though it was clear that it was an error.
Yeah,
We would just file a grievance with the insurance company and say, all right, you know what, insurance company, we've tried to rectify this and go through all the appropriate channels. We're gonna give you our side of the story and you go deal with it with the provider. And they are really good about taking care of those things. I think that, what's your average, it's like 30-day turnaround with a grievance usually. So if you file a grievance, about 30 days, at least they're gonna have some kind of answer for you,
yeah,
which is really nice. So there's a fail safe always.
Okay.
And then just before I move off of this screen, I want to go backwards because I skipped
Yeah.
ahead. This was a slight adjustment for, there's two buckets again for dental. We have medical related issues, things that like affect your ability to eat, speak, or drink, actual illnesses like cancer of the mouth, things like that. And then you have dental services related to oral health, but like your cleanings, crowns, x-rays, that kind of a thing. It's a little bit different in how they're, I mean, I know that if you have an abscess tooth that can affect your health, but they are different. It depends on the situation. So this is really related to like the medical issues, or if you have like a direct injury to your face, this is a slight change. It's a $35 copay versus a $30 copay. We are going to get into the actual dental coverage because this plan does have dental built in as well. So let me go back. We're going to talk about ambulance services, slight modification. It went from a $250 copay to $275, and that's ground or air. So that is the cheapest helicopter ride you're ever going to get. Let me tell you, I did those little excursions on a cruise, and I was like, oh, helicopter ride. Oh, I'm not paying that. So I would have loved to be able to go for $275, but not if I'm hurt or sick. So I hope you never have to use it, but it is still really, really low copay considering if you're under 65, since you're saying you're still on a group plan. I can guarantee if you were lifeline, you probably were going to hit your max out of pocket. Guaranteed. This, not even scratching the surface with that. Don't even worry. Outpatient surgeries. Let's talk about that. This is another thing people are like, oh my gosh, I'm going to hit my max out of pocket. No, 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 no. This year, it was a $100 copay at an ambulatory surgical center. So an ambulatory surgical center is just a facility that doesn't have an emergency room. All they do is those types of outpatient procedures, you know, carpal tunnel, cataracts, joint replacement surgery, that kind of a thing. And you're just in and out usually, or maybe you have an overnight stay, something like that, but that's pretty much it. And there's a lot of value in that. First of all, we have a savings. So you're going to pay $150 versus $275 at a hospital. So if we were to go to an actual like St. Luke's hospital, and I encourage people to look at a surgical center, one, because of COVID, who wants to go to a hospital and have a surgery when there's a bunch of sick people around there, and there's huge savings, as you can see. And I think we need to get used to and more comfortable with the idea of a surgical center, since the hospitals aren't even taking most surgeries right now. They're actually funneling people to those surgical centers because, well, everybody's using up all the beds, right, for this Delta variant that's going around. So that's just something to keep in mind. But if you do end up going to a hospital facility, it is a little bit more. It's $275. Just ask your doctor if they have privileges at a surgery center, and again, you'll see that there's some significant savings.
Is there a surgical center here in Boise?
There's plenty, yeah,
Oh,
and
there
we can get you what those options are.
I do have a surgery that they were going to take me downtown to St. Luke's Surgical Center. I mean, that's what they called it,
Mm-hmm.
but it's
So it's
St.
not the
Luke's-
hospital, because they probably
it's a
do have
separate
their own
building down
surgical
there
center.
in downtown Boise.
So it should be,
But I didn't know if it qualifies, and maybe you'll
Yeah.
on that later.
yeah, no, we can double check that. It should be though, if it is a surgical center, not an
Yeah,
actual hospital. So it just depends on the
Okay.
facility, and
Yeah.
so we'll double check. And if you're having it in 2021, it's 100. If you have it in 2022, it's 150. Slight change. 150 for a new knee?
Yeah.
150 for a new pair of eyes? Or one eye? I guess they only do that procedure one eye at a time. They don't want to make sure, I guess they want to make sure they don't mess up both eyes if there is
Right.
a problem. I've learned that recently. Okay, my bad, sorry. We're adding a little humor to the insurance conversation today. Okay, as promised, we're going to go into the dental stuff because I thought this was a cool benefit that not every carrier has, and we appreciate that Blue Cross embedded that at no additional cost to you. You basically have $1,000 of dental coverage. Your preventative services are going to be covered at no charge up front, so you have no copay for those cleanings, exams, x-rays, and fluoride. And then they are so nice as to break down on their summary what the limits are so that you have no surprises. So you get 2 cleanings every year on 2021. In 2022, they added an extra visit. They gave you an emergency visit for an exam. So you get 2 preventive and 1 emergency. So there's an extra one for you. So that way if something did come up and throw you off guard, you're not like, oh wait, now I'm out an exam for my usual 6-month follow-up. So I thought that was a really awesome plug in, because guess what, that happens. Sometimes all of a sudden you wake up and you're like, oh my God, my tooth is killing me. Now you don't have to burn that one preventative exam, and you could just use that emergency exam. The prophylaxis, which is your cleaning, is 2 a year, so that's standard. Typically people go every 6 months, right? And then you have your bite wing x-rays once a year, and your fluoride treatment once a year. Usually don't need more than that, so we like to point that out. And this one's a big one. Full mouth x-rays is every 3 years, because again, we don't need that every single year. So this is a really good outline. So if your dentist tries to say, oh, I think you need this, you want to keep in mind what your plan limitations are, okay? If you're not sure, we again are sending copies out of everything, so you guys will get that even in your renewal packet.
So any routine, oh, you're going on.
Oh yeah, this is continued, because that was just the preventive. So
Yeah,
now we're
yeah,
gonna
I
go
see.
into
Okay.
the big stuff. So I got a lot of green on the screen again, because it gets even better. So this year it was no copay for things like fillings, extractions, same tooth, surface restoration. So you still didn't have your copay that was applicable. Where it changes for 2022 is they moved things from the major service category that you would have normally had to pay 50% of the total cost, or the allowed amount that they have with that doctor, that dentist. They moved that to the zero copay. So they moved things that you were normally paying 50% on to that zero copay. And so that's going to include the root scaling and planing, which is a major, that's when they come in with the drill bits there to clean the teeth. It's like a hydro clean. And they go by quadrant. So you have 4 quadrants in your mouth. You have upper right, upper left, lower right. So that's usually how it's broken down. And so you essentially get that for each quadrant, not to exceed 4. You only have 4. So that's why they have that limitation there. Yeah, can't use it on your neighbor, sorry. Or if your husband, needs extra, sorry, it's only for you. The periodontal maintenance, so that's when you need it's not as high of a root scaling and planing, but it is the next level of cleaning. So it is a deeper cleaning. We like that was included for the basic service in 2022. And then full mouth debridement. I hope that you guys don't have to go through it, but if you do, the fact that they moved that up is pretty big. And this one you wouldn't need very often. It's every 3 years. If you're getting it every year, oh my goodness, I'm so sorry. But major services, what we do still see for this category in 2022 would be, of course, the crowns, because those are very expensive, bridge repairs, root canals. They did make a slight modification. Root canals were covered every 5 years last year, and now they're going to be every 7 years. And that's typically because if your dentist is doing it right, you shouldn't need another root canal for 7 years. It should last you. If not, we got problems. Right? Maybe need a new dentist. Yeah, the materials are falling apart or the job wasn't done right. So this is really great coverage to have embedded at no additional cost. Dental is super, super expensive. Again, not every carrier does this, and I like that you guys broke it down like this and put so much into the zero category, because not everybody has that. Now, I will also plug in, we may have a need for more dental coverage than just $1,000, because an implant, for example, or a crown even, is going to exhaust that $1,000 limit most of the time, because they are so expensive. So dental can be added throughout the year. So if you do find that you need more coverage than the $1,000, we love that this is a good running start, but you can always call and ask us, hey, it found out dentist wants to do X, Y, and Z, and my $1,000 benefit's not going to cover it, because this $1,000 benefit isn't just for your basics, your major services that you're paying the 50%. It's what they've also paid for the cleanings and all the basic services. So even though your cost was zero, they still were paying on the back end. So it is.
So they're billing out the cleanings
Yeah.
that go against your $1,000.
Goes against the $1,000.
Oh, I thought it was my $1,000 I paid.
No. This is not what you would call a maximum out of pocket, right? Like on the medical.
Oh.
This is a true
Service.
coverage limit. What they pay is $1,000.
Oh,
So that's why I'm
sweet.
saying,
Yeah.
if you have 2 cleanings and then you find out you need an implant or something, you may need some extra dental coverage, and there are options. Blue Cross has standalone dental plans that you can add throughout the year.
Yeah, you can add them
They
All
have a
three?
Medicare one, but they also have individual plans that
Oh,
can
just
be
a general.
added. Yeah, so it just depends on what the need is and the timing. So if it's outside of open enrollment
Yeah.
and you're not able to include, an optional dental buy-up, if you will, then we can do that at a later time.
Okay,
There's plenty of options. So that's a really cool thing to know. So you're not left feeling like, oh my gosh, I missed the boat. No. You don't have to pay, those crazy prices. Check with us first. And if anything, we'll tell you what the price would be with
Yeah.
insurance, and you can use that to negotiate a cash price with your dentist.
And most people actually only need the additional dental for things like implants or dentures,
right.
Yeah.
stuff like
Yeah,
that.
high end.
So we have an optional plan that you can purchase that has a $3,000 benefit
That's huge.
associated with it. So,
Oh,
And is there a limitation on when they can sign up for that?
all of your long.
See, that's the big one.
Okay,
So then the Medicare plan counts as credible coverage prior to a Healthy
is.
Smiles plan?
Absolutely.
Okay.
That's awesome. How cool
Any
is that?
Medicare plan or just Blue Cross?
Only Blue Cross. No, it is a
I mean-
Medicare plan. Yes,
Good to,
it is
good to
credible
ask.
coverage.
And then to remind you, there is the fitness program through Silver and Fit that's available where they're covering your cost for your gym membership. There's a list of gyms that you can go to, including the Y. I know that's a big one, but they've got a lot of big names. And notice it says statewide or nationwide because we do have snowbirds. So if somebody was out of the area for an extended period of time, they still want to use that gym membership, they are still able to do so. There was really only one minor adjustment, and I think it was just due to utilization, wasn't there. There was a Stay Fit Kit option if you didn't want to go to the gym, and they also have a home fitness kit that you got. So next year, they're still including the home fitness kit, but they did away with the Stay Fit Kit. I don't even know any of my clients that use Stay Fit Kit, and that's why they got rid of it. Yeah, because if nobody's gonna use it, well, we're just gonna remove that from the benefit, but they're gonna keep the big part, because bodies in motion can stay in motion, right? So we want you to stay healthy. So there's a lot of options, and they have a whole list, not just gyms that are, like Axiom and whatnot. They even have some of the specialty gyms like yoga studios and cycling stuff and all of that. So there's something for everybody. And if you don't want to go to the gym because you're concerned about, health or safety, or you just aren't comfortable with all those meatheads that like to grunt and I don't want to deal with that, you could do the home fitness kit.
What's in the home fitness kit?
I don't know, Sean, what's in the home fitness kit?
I've seen the rubber bands, stretches, exercise routines, stuff like that.
is it a physical package kit that you
Yeah.
get a gadgetry to work on?
Yeah.
I mean,
I'm sure they include like programs in there for you to try, like, hey, this is how you use this, and these are the exercises that will help with X, Y, and Z, so you can kind of pick and choose what you want to do. Yeah, those resistance bands will kick your butt, let me tell you. You do some squats with those, you'll feel the burn real quick. Sean knows, he does it all the time, I see him, right at his desk.
Back to the list of members or qualifiers, is that something you could provide me with?
Yeah, absolutely, and they have like a website that you can
Oh,
plug
oh,
in
okay.
which we send, of course.
Yeah.
But they have, why I tell you about that is if you're out of the area and you
Yeah.
plug in your zip code,
Yeah.
it'll give you the gyms that are
That
available.
are
So they
qualified.
really try to make that, I like using the online tool because there could be gyms that are being added to all
Yeah.
the time.
Okay,
So I just like to double check because you never know, there might be something new that gets added.
Yeah,
They're
yeah.
always expanding the provider or, gym
right.
locations.
Qualifiers, okay.
Yeah. Okay, so a couple other adjustments. Podiatry services is going to match that specialist copay. So notice on the specialist, it was 30 this year, going to be 35. Well, podiatrist is a specialist, so we're going to see podiatry services also match that. It's listed separately, typically for people who have illnesses or conditions where they need to be really mindful of their feet, diabetics specifically. Really got to make sure you're following up on that. And if you're having, any issues, we just had a conversation with somebody about it, getting their toenails trimmed if they were having a hard time reaching. That's usually included in those podiatry services. So not the nail salon, but going to a podiatrist. So
Right.
we had somebody in a meeting ask about, oh, well, is my pedicures covered? Only if you see a podiatrist, because they're doing more than just clipping your toenails. They're checking the feet, the health of your feet, making sure everything's working the way that it's supposed to. They can check for neuropathy and all of that. So it has to be a medical benefit. There's no way for these carriers to bill a nail salon. So as much as I would love my pedicures to be covered, you want my bill every month for my pedicure shop? They ain't gonna do that. Medicare will never come to terms with that. But from a podiatrist, absolutely.
Makes sense.
Yes. Okay, skilled nursing facility. So this is when you don't need the hospital anymore, but you're not quite ready to go home yet. It's kind of like an in-between stage, right? So basically, rule of thumb, get better within the first 20 days because the plan's going to pay 100% of that. And this is going to work very much like that inpatient hospital copay. Days 21 through 100, you would have a per day fee, and it would cover everything that happens to you while you're there. This year it was $180 per day. It goes up slightly to $188 per day. And again, the rule of thumb, get better in the first 20 days if you can, because the plan's covering that. And you may not think that you need this, but you would be really surprised. We had a client who went down to Utah to visit her grandkids, tripped over the family wiener dog, broke her femur, and doctor was like, you can't fly home and you can't drive home. You just had surgery. We do not want you throwing a blood clot. So what ended up happening was she got prescribed to go to a skilled nursing facility until she was well enough and out of that threat. Right? And so again, you may not think you need this stuff, but it is important to know because you never know when a wiener dog is going to take you out. Okay, and if we're driving you crazy, don't worry, there's mental health coverage built into all these plans. We did see a slight modification. It's going to pretty much match that inpatient hospital stay. We saw that it was $295 a day for the first 5 days in 2021. So it's going to match what it's changing to, just like if you were to go to a hospital. So it's $315 per day for the first 5 days. And then after that, plan pays 100% if you have a longer stay than that. We also saw a slight adjustment. You had a question about x-rays and things like that. We did see a slight adjustment. This year it was $0. It's going to be $15 for x-rays or lab work, which is still very, very nominal. Let me tell you, I'm about to go through a lot of lab work and they already prepared me for the bill. I was like, okay, that sounds really awesome. I would love to pay $15, but I am not on the Cool Kids Club. So it's a really nominal fee, and it is also important to know that it is per visit, not per test. So if you go and have 12 things done, it's not 15 a pop per vial, it's 15 for the visit. So I think that's a big thing to add as well. I'm actually gonna let Sean talk about the worldwide coverage, because I think this is a huge add-on that people don't really know, and this gives people the peace of mind for when they're traveling. Do you want to talk about Blue Cross's coverage?
So worldwide coverage from Blue Cross, you've got $25,000 outside the United States to use in the event that you need some medical attention. And so worldwide coverage has a $90 copay.
And that's huge, right? Travel to have first $25,000 covered. You don't necessarily need to have a travel benefit plan on top of that.
You don't. So it's nice that it's embedded in the plan. If you needed more coverage with that, for that, if you need more coverage or you're concerned about that amount of coverage, we have other options, you know,
GeoBlue.
GeoBlue,
Yes,
a very inexpensive way to gain a lot more coverage there.
absolutely. But at no cost, I don't see another carrier that has $25,000 as the benefit. That's pretty big. And also another big add-on to Blue Cross is if you were outside of the coverage area, being the United States specifically, they weren't covering the ambulance transportation in that $90 copay. And next year, it's a $270 copay for ambulance transportation. So before, you paid for that ambulance transportation. Now, it's only $270. That's huge, because guess what? The chances are, if something big happens, you're gonna need that transportation. So they're looking out for you. If you wanna go to Mexico, you wanna go to Canada, you wanna go to Europe, I don't know if people wanna go to Europe right now, but that's okay. If you do, it's there. So that's a really nice plug there. Are there any other benefits and things that Blue Cross is doing now that people need to know about? Why Blue Cross?
I think some of the big reasons to choose Blue Cross, you know, we've got, for the St. Luke's plan, we've got a $60 every quarter over-the-counter benefit, so you can get Band-Aids or aspirin or,
What was the
cough
dollar amount?
medicine,
60.
60?
$60 every quarter, yeah.
Wow.
And so there's a digital catalog that you can select those items from. It's a use it or lose it, so you just spend up to that $60 a quarter
Oh,
and fill up your cabinet with stuff.
That's like vitamins.
Vitamins are included, yeah. Yeah, there's a,
so it's through a
Hundreds.
website kind of thing or something?
yeah, you can go to bcidaho.com/OTC and you can get a catalog there.
Okay.
And do you guys send that out in your packets?
So that information is sent out in those packets.
Oh, nice. So if somebody wants to renew with Blue Cross, they'll get their
They'll see
renewal packet with their cards and the new catalog.
the instructions on how to order those items directly from,
Is it
CVS.
CVS also?
it's from CVS. Yeah.
Wow, that's
In
awesome.
addition to that, we're a local company. We're right here. We're in Blue Cross today, and we're here to help you. Obviously, your biggest Blue Cross asset is Jenna Page. So we're thankful to have her as a partner. But anytime you had an issue that came up, if you wanted to walk into our building, you have the ability to do that.
It's huge. Absolutely. And I know for one that Blue Cross has great customer service. It's one of the carriers I don't have to worry about when a client wants to take charge and call in on their own, because Blue Cross does go the extra mile to see that call through and making sure that you got what you wanted or needed. And I really appreciate that. So I can't say that about every company. There's some carriers I am really adamant. I have our clients call our office instead of calling direct. I still encourage you to call us for everything if you can. We try to make it easy. You can call us, text us, email us, live chat us on our website. But I love having that partnership with Blue Cross because it is local support and they care. And they're not worried about how fast they need to get that person off the phone. They're more concerned about getting you the solution that you're looking for. So I do like that.
And we've built a great name. So
Yes.
we are local. The money that we generate stays here in our community. It's not being sent out of state. So that's a big thing. We have you in mind. And we touched on it earlier about the amount of money that we make and how much we can keep. We have to spend 85% of the money that we take in on you. We can only keep 15% of it. So if we have a really, really good year, we have to create additional benefits. And that's where you see all the green. And the items where maybe the loss ratios are a little out of whack, that's where you see some of the reds. Or we're just trying to get in line with some of the other carriers. So, but we're here for Idahoans.
I love it. Well, thank you guys for attending. I don't know if there's any questions online, but thank you guys so much. We're going to be having another presentation here shortly going over the the True Blue RX Preferred Plan that includes both St. Luke's and St. Al's. It's a larger network. So if you're interested in that, feel free to join us. That's going to start at what time, Kendra?
At 3:30.
3:30.